Hi, my name is Kayla Campbell and I'm a student nurse here at the University of South Alabama, and today I'm going to be performing my medication administration checkoff. And so here is my ID. I'll now scan the room. And place my camera in the correct position. So I'd like to begin by saying that I would find an interruption-free space in the hospital, and I have tried to create that for myself here. So now I just begin by comparing the MAR to the chart. So here we have Jaguar Jones and Jaguar Jones, and the order is heparin 5,000 units subcutaneously every 12 hours and heparin 5,000 units subcutaneously every 12 hours. So now I'll go ahead and do the first set of the 5 rights of medication administration. So we have the right patient, Jaguar Jones, the right drug, heparin, the right dosage, 5,000 units, the right route, subcutaneously, and the right time, every 12 hours and every 12 hours. I would also like to note that Mr. Jones has an allergy to penicillin noted both on his MAR and his chart. So I would now perform hand hygiene and select the correct medication. So our MAR says heparin, so we're looking for heparin. And heparin is right here, and it says heparin 10,000 units per milliliter, and the expiration date is 12/5/2025. So it's well within its expiration date and good to use. So the MAR also says every 12 hours. It was last given at 7 a.m. and it is now 7 p.m. So it has been 12 hours. The MAR also says it is given subcutaneously, and so I'm going to identify the correct needle to administer subcutaneously. And so I usually, for a subcutaneous injection, more specifically a 90-degree subcutaneous injection, you'd use a 25 gauge half-inch needle. And I was not provided with this specific needle, so I am going to be using a 28 gauge half-inch needle on a 1 milliliter tuberculin safety syringe, And I don't think this will be a problem because heparin is quite liquidy. So now I'm going to move my vials and other needles out of the way just to create some more working space for myself because my space is quite limited. So now the MAR also says I am to give 5,000 units, and this heparin is supplied as 10,000 units per milliliter. So I will be administering half of a milliliter. So I'm going to now prepare that. And I'm going to first clean the top of the vial, and I would normally have a good sterile pre-packaged alcohol swab, but I did run out, and so this is just the swab itself, and that would in no way be appropriate in a clinical or hospital setting. So I would like to verbalize that. Now that the top of the vial is clean, I'm going to move the needle and syringe and go ahead and draw back half of a milliliter worth of air. Remove the cap and then inject this into the heparin vial. And so now I'm going to flip this upside down and go ahead and pull back half of a milliliter's worth. I'm actually going to pull back more this time and go ahead and push it all back in. Just make sure and get all the air bubbles out. Okay, that is half of a milliliter. So I'm now going to scoop my cap and come and show you. So it is half of a milliliter, and my lines are kind of rubbing off. I hope you can tell. So now that I have the dosage in the syringe, I would get another nurse to verify my calculation and dose. And so now I'm going to perform the second set of the 5 rights of the 5 rights of medication administration. So we have the right patient, Jaguar Jones, the right drug, heparin, the right dosage, 5,000 units. It's supplied as 10,000 units per milliliter, so we're giving half of a milliliter. The right route, which is subcutaneously, I have a correct TB syringe, and the right time, which is every 12 hours. Again, it was given at 7 a.m. It is now 7 p.m., so it has been 12 hours. So now I'm going to create a label for the syringe, and the label will include the patient's name, the drug name, and the dosage. So I'm going to write Jaguar Jones, heparin, and 5,000 units. And put this on the syringe, making sure to never touch that inner plunger. Okay, now that I have that, I would go into the patient's room. And so I will bring my MAR. I'm going to set my chart aside. I'm going to bring my MAR and my medication into the patient's room. Move all of this over. I'm now in my patient's room. And so I perform hand hygiene and then identify the patient using 2 identifiers. So we have here Mr. Jaguar J. Jones, and his medical record number is 4176352. 4176352. I would also note his allergy to penicillin, both noted on the MAR and his wristband. I would then ask Mr. Jones about this allergy to penicillin and ask him what his reaction looks like or any other allergies that he may have. And now I would perform any pre-administration assessments, and I do not particularly have an assessment to do for heparin, but I would make sure that there are no contradicting illnesses or diseases that the patient has that contradicts the use of heparin. So now I am going to explain now I'm going to do the third set of the 5 rights of medication administration. So we have the right patient, Jaguar Jones, the right drug, heparin, the right dosage, 5,000 units, the right route, subcutaneously, I have the correct TB syringe, and the right time, and again, it was last administered at 7 a.m., it is now 7 p.m., and so it has been 12 hours as noted on the MAR. So now I would explain the procedure to the patient and tell him that I'm giving him his injection in the abdomen, or subcutaneous injection in the abdomen of heparin, which helps him not have a clot in his blood. And I would now raise the bed to an appropriate working height and lower the side rails. And I will now put on my goggles and gloves. So now that I have on my goggles and gloves, I would identify the correct injection site. And as I said a minute ago, the best place for a subcutaneous injection is the abdomen. And so for this injection, we are going to be using the abdomen, and you would identify a 2-inch border around the umbilicus, making sure not to go above the intercostals or below the lower pubic area or past the superior anterior iliac spine on either side. That leaves you with a nice U with multiple spots for injections in the abdomen. So now I am going to clean my injection site. And as I said earlier, alcohol swabs usually come prepackaged and sterile. I did run out of them, so I am just using the swab. And this in no way would be appropriate in a hospital or clinical setting. I would have the prepackaged ones, and so I would like to verbalize that. So now I'm going to clean my injection site. I'm going in circles and then disposing of that. And now I'm going to remove the cap and grab 2 inches of skin and squeeze, and then insert my needle at a 90-degree angle, inject the medication, throw it in the sharps bin, and apply gentle pressure. So I would now position the patient comfortably and lower the bed and raise the rails. And then I would remove my gloves and goggles and perform hand hygiene. I would assess the patient for any allergic reactions that they may be having to the medication that was just administered. And then I would move on to the 6th right, which is documentation. And so I would document the procedure in the MAR, and I would document how the patient handled the procedure. And then I would come back later and reassess the patient's response to the medication that was administered. And that completes my medication administration checkup.